Hi, my name is Xiaoping. I'm a physician in gastroenterology at MercyOne Des Moines. My inspiration to be a physician was based on my personal experience. When I was very young, I had a refractory fever. My mom thought I would die, but the doctors and the nurses provided exceptional care to me, and I survived. This story really led me to be a physician today. I know practicing medicine can be challenging, but it's also a very rewarding experience to me. When I look back on my patients, when I believe I was really able to help them by either uncovering the diagnosis or identifying a way to set them on the pathway for great recovery, I feel everything was paid off. As a gastroenterologist, I'm taking care of patients who have disease involving their GI system, such as acid reflux, dyspepsia, or some liver disease, such as alcoholic hepatitis, autoimmune hepatitis, fatty liver, liver cirrhosis, and also inflammatory bowel disease, even GI bleeding. Your doctor may send you to us, or you may decide to come to us if you have symptoms that affect your GI tract or liver, such as acute or chronic abdominal pain, persistent nausea, vomiting, chronic diarrhea or constipation, black stool, or even bloody stool or jaundice. My care philosophy is try to provide the best health care to my patients. I really enjoy developing great personal connections with my patients and treat them individually. In order to do that, communication is the key. One of the greatest things here at Mercy, we always have enough time to spend with our patients, which really allows us to establish a nice relationship with our patient. I like to talk to my patient. I always encourage them to tell me their own stories. What's the specific reason that brought them to our GI clinic? What's their goal of this appointment? So I can come up with a plan with them together to address their individual needs and concerns. I feel this is important. Sometimes after I talking to the patient, I realized the reason that the treatment was not effective simply because the patient didn't take their medication correctly. Instead of switching medication from one to another, I will educate them the correct way to take their medication. Their symptoms are well controlled and they become happy. I'm also an active researcher. As a physician, I saw a lot of research projects have dramatically changed the way how we treat our patient. Here at Mercy, as a tertiary medical center, we will try to offer our patient the opportunity of being involved in some clinical trial if they are willing to. Again, the goal is to provide the best patient care. I want my patient to feel assured I will care for them as any member I would for my family member. When I'm not practicing medicine, I love cooking, watching movies, jogging, and traveling with my family, especially exploring some new food in local restaurants. practicing medicine can be challenging, but it's also a very rewarding experience to me. When I look back on my patients, when I believe I was really able to help them by either uncovering the diagnosis or identifying a way to set them on the pathway for great recovery, I feel everything was paid off.